I recently gave a talk to the NUIG Vegan Society about some thoughts on the teaching of nutrition in medical school and some other stuff. But like an idiot, I didn't have my mic switched on, so the recording I took of the talk is unusable. Instead, the following will be a condensed version of the talk adapted to a video format. I started off by asking how many vegans were in attendance, and of those, how many thought their health was going to suffer as a result of going vegan. So I suppose that's the first thing I'll ask you guys. Comment below whether or not you're vegan, and if you are, why? And especially if you thought the decision was going to negatively impact your health. The reason I bring it up is because I myself was in that camp. So a little backstory first, though my own vegan story isn't very unusual. I watched the documentary Earthlings and was absolutely horrified by what I had seen and immediately went vegan that day. But the reason I bring it up is because I thought my health was going to suffer as a result. You hear all this scary stuff about protein and B vitamins and subacute combined degeneration of the spinal cord and all the rest. And the thing is, I wasn't actually completely nutritionally illiterate at baseline at the time. I already had some knowledge from a gym bro weight training type perspective, and I had always taken a passing interest in the subject anyway. So of course, inevitably I began investigating what exactly these negative health consequences I was in for were going to be. And I remember distinctly that this was one of the first papers I came across, the 2009 position paper from the American Dietetics Association, stating that appropriately planned vegan diets are healthful and nutritionally adequate for all stages of life, including pregnancy and lactation. And more than that, not only can plant-based diets be nutritionally adequate, but I quickly discovered that they can actually lower your risk of disease instead of increasing it, including some of our top killers like heart disease, cancer, diabetes, and Alzheimer's disease. And even more amazingly, we can even reverse some of our most common chronic diseases with a healthy enough diet, including heart disease, early-stage prostate cancer, and type 2 diabetes. Even just education and encouragement to move along the spectrum from the standard Western diet to one focusing more on whole plant foods can remarkably improve risk factors for these same chronic diseases, such as high blood pressure. These results were far more impressive than any other intervention I had learned about thus far. I was under the impression that these diseases were mostly down to genetics, and that the best we could hope to do is to manage their effects with drugs and surgery, with inevitable disappointing results. You might bypass a clogged coronary artery and provide a period of relief, only to have the graft itself eventually clog up, or pursue a watchful waiting attitude towards precancerous prostate lesions, leaving men in a constant state of anxiety and uncertainty, and very often eventually maimed in the most intimate ways following prostate surgery, or eternally battle the labile blood sugars seen in type 2 diabetes with an ever-increasing complex regimen of injections and pills, a universally losing battle with patients often developing kidney disease, going blind and requiring amputations. And of course, risk factors can be controlled with drugs too, but like other medical interventions, they always come with a list of side effects and very often provide extremely underwhelming and disappointing results for a huge cost. These conventional interventions are nothing like what we can do with whole foods, plant-based nutrition. So as you can imagine, I was furious. How had I managed to make it this far through medical school without learning about this stuff? The opening up of clogged atherosclerotic coronary arteries, getting off insulin in just 2 weeks of eating right, the reversal of essential hypertension with no side effects. Why were these not the first things they taught us? We have the ability to prevent, treat and cure these common, debilitating and deadly chronic diseases much more effectively without the side effects or huge costs of conventional treatments. But I just want to clarify something here. It's not the doctor's fault that the practice of medicine is based around prescribing drugs and surgery. We simply aren't taught about the power of diet and lifestyle. It took a medical student randomly stumbling across a vegan documentary with a curious enough mind to investigate the health effects of the diet to discover this stuff. Other than that, I would have graduated without ever learning this amazing power we have over our health destiny. Yet doctors are considered by the public to be among the most trusted sources for nutrition-related information, second only to registered dietitians and nutritionists. And make no mistake, this lack of training in nutrition for medical students is absolutely the norm. In a survey of EU medical schools, of the schools that returned the survey, some did not require any nutrition training at all, and those that did only required an average of 24 hours of nutrition education. And you can bet that there was some serious sampling bias here, and this number actually appears to be trending down. The situation in Ireland? Of the 2 schools out of our 6 that responded, both reported that nutrition education is not required. Just to put this in perspective, basic medical education in the EU, including Ireland, must consist of no less than 5,500 hours of contact time. So at best, the medical education of doctors in the EU is less than 0.5% nutrition related. And that would be fine if less than 0.5% of deaths and the diseases we treat were nutrition related. But according to the Global Burden of Disease study, which offers the most rigorous analysis of risk factors ever published, dietary risks are the #1 risk factor for death globally, and nutrition related risk factors dominate our leading causes of death. So for 2017, almost 11 million deaths were due to direct dietary risks, and diet contributed to tens of millions more. So that's less than 0.5% of our time spent learning about nutrition, yet it is the #1 risk factor for death and contributes to many, many more. So why this huge disconnect? Briefly, there has been a failure of healthcare and medical education to adapt to the transition from acute disease as the dominant health problem to chronic disease. So until this adaptation occurs, drugs and surgery-centered medicine is likely to persist. At this point, I wanted to switch gears and provide my audience, which consisted primarily of college students, with something a little more positive. So if you're watching this now and are in college yourself with exams looming, this may be of benefit to you too. In the spirit of being one of the most trusted sources for nutrition-related information, I'm going to give you some actionable nutrition advice right now. A plant-based diet can support optimal brain health and functioning, but I'm going to suggest a few foods you might want to specifically focus on to gain an edge in your exams. In this double-blind, randomized, placebo-controlled crossover trial on college students, 2 servings of walnuts for 8 weeks appeared to significantly improve inferential reasoning. Might be worth adding some walnuts to your diet over the next few weeks. There is promising evidence as well that anthocyanins and other flavonoids found throughout the plant kingdom, but especially in berries, offer a cognitive boost with both long-term and acute use, concludes this systematic review. A healthy serving of blueberries on the morning of your exam may also give you an edge. And dark green leafies appear to boost cognitive performance through a variety of mechanisms, including their high nitrate content and the carotenoid phytonutrients lutein and zeaxanthin that they contain. So maybe something like a green berry smoothie with a handful of walnuts for breakfast over the next few weeks might be just the fuel you need to have your best set of exams ever. So that was my talk to NUIG VegSoc. Thanks for watching, and I hope you found it informative. Feel free to leave any questions or comments you have in the comment section below. That's it for now, guys. Talk to you next time. Slán.